Hi, I'm Dr. Melvyn Hecht. I'm Deputy Director of Geriatric Medicine at Maimonides Medical Center. I'm board certified in internal medicine and geriatric medicine. I actually started my medical career here in Brooklyn. I was first went to medical school at Boston University, but my residency was at Downstate Medical Center. I was chief medical resident at Downstate Medical Center, and I started in geriatrics here in Brooklyn as part of a demonstration project in geriatric medicine in its infancy. Actually, my fellowship was at Cornell Medical College at that time. The reason I chose geriatric medicine is because it's more holistic than the general specialty practices. While a general internist should be able to treat and practice geriatric medicine, I think what the geriatrician brings to the field of medicine is a better understanding of the holistic picture of the patient. And especially in older patients, the issue is not only about their diagnosis and treatment, it's about the effect of the diagnosis and treatment on the patient and their ability to actually take those medications or tolerate the treatments. And that's what I think geriatric medicine brings to the table. Through the years, I've been mostly interested in two aspects of geriatric medicine. One is Alzheimer's disease and related dementias, and have worked on demonstration projects related to that. And secondly, my current interest is in actually the transitional care of geriatric patients. The highest risk for elderly patients is when they transition from one care setting to another. For instance, when they've been in the hospital and they go back home, hopefully they go back home, that transition of care is ultimately probably the most dangerous time for them because they're on new medications, they may have gotten new treatments, and sometimes that transition doesn't happen well. So here at Maimonides, we're actually looking at better practices in transitional care from hospital to home. One of the things about medicine in general, in our era, and as the healthcare debate has told us over the last year plus, is that there is so much about medicine that is focused on insurance, time, how much time can you spend with the patient. As a geriatrician, what I hope I bring to every patient encounter is that the sense that the patient feels that I'm not giving them, that I'm giving all the time that they need, that they're not hurrying them out of the office because there's another 3 or 4 patients waiting behind them. Compassion is about listening, having the time or making the time to listen to the patient, to hearing what their needs are, to thinking about how you can support them best in their community, hopefully keeping them in their home as long as possible. That's what I think that brought me to geriatric medicine, and what I think that is about compassionate medicine is hearing the patients, spending time with them, and hearing all their issues, not just what their sort of disease of the month is. I think in geriatric medicine, I think we think of clinical breakthroughs slightly differently than in the surgical and some of those other specialties, because geriatric medicine is not a technological specialty. We don't have a gyroscope. I think that we look at geriatric medicine from the perspective is, are we doing the right thing for the patient at the right time and in the right amounts? Common mistakes that happen in geriatric medicine is that patients may go to several specialists, each who are treating that patient appropriately for the disease process or the complaint that they go to. But when you add up all their medications, you're putting that patient at a special risk for medication intolerance or even adverse side effects. So I think that geriatric medicine, rather than bring technology, brings new insights into better care. And I think that that's where geriatric medicine is really bringing sort of fresh ideas to the field of medicine. I went into geriatric medicine because I really believed in the holistic care of patients, and sort of one of the proudest moments is I was in Boston for 17 years prior to coming to Maimonides about a little over a year ago, and there was there's a organization called the Schwartz Center, and even here at Maimonides Medical Center we have the Schwartz Center rounds. The Schwartz Center is focused on caregiving, not actually how good you are at treatment or diagnosis, but how good a caregiver. And just prior to leaving Boston, I was nominated, didn't win, but was nominated as Compassionate Caregiver of the Year. So that's really my proudest moment, and really sort of what brought me to geriatric medicine, as being a compassionate caregiver.